So in this chapter, I'll be talking a little bit about autism spectrum disorders as defined in the Diagnostic and Statistical Manual. We already talked about what my mentor used to describe as autism with a capital A, having deficits in those three areas: the quality of the communication, the quality of the social interactions, and then restricted interest and repetitive behaviors. Asperger's disorder, childhood disintegrative disorder, Rett Syndrome, and then pervasive developmental disorder not otherwise specified. Let's start off with Asperger's disorder. So Asperger's, by definition, you have impairment in the quality of the social interactions and then still have the restricted interest and repetitive behaviors. So it's much like autism, except you don't have impairment in the quality of the communication. Now this gets confusing. It's confusing in the sense that many children who are diagnosed with autism in early childhood have language delay, but often their language delay resolves to where when they're school age, all they have are the impairment in the social interactions and the restricted interest and repetitive behaviors. So what's their diagnosis? Do they have Asperger's, or do they have autism with resolved language delay? Now, one of the exciting changes that's coming for the diagnostic criteria for autism, this change that's proposed in the Diagnostic Statistical Manual 5th edition, is incorporating Asperger's under the heading of autism spectrum disorder. So we no longer have to worry about that confusion where parents will often wonder, is this autism or is it Asperger's? It's all going to be autism spectrum disorder. Often people think of Asperger's as being mild autism. By diagnostic criteria, it isn't. Children who meet diagnostic criteria for autism generally have impairment in their communication, and so it seems more severe. But I'll have children with high-functioning autism that still have some communication delays, and children with very low-functioning Asperger's who might be much more impaired, but don't make diagnostic criteria for autism. Pervasive developmental disorder not otherwise specified. It's a diagnosis I try not to make too often. Sometimes where I'll make the diagnosis of pervasive developmental disorder not otherwise specified is in children that I'm seeing for the first time, where I've had get a history of some language delay, get a history of some impairment in their social interactions, some restricted interest repetitive behaviors, but maybe they've had a lot of very aggressive therapies and now they're doing much better, to where if I do some sort of rating scale or diagnostic test for autism, no longer meet diagnostic criteria for autism. Sometimes I might call that resolving or partially treated autism, and that's just a little bit of something to come as we talk about at the end of this video of can autism go away. But that's a situation where I might use that diagnosis of pervasive developmental disorder not otherwise specified. Rett syndrome is a very severe progressive neurodegenerative condition which for now is categorized as a pervasive developmental disorder. And childhood disintegrative disorder is autism features but with a progressive sort of neurodegenerative course. In the next chapter we'll be talking a little bit about how to make a diagnosis of autism and the prevalence of autism. Is autism on the rise, or are we just diagnosing it more and more?